you know, unfortunately, orthopedics is the least diverse medical specialty for race and gender. This is a heat map showing the representation of women in orthopedics around the world. And you can see that no country has more than 30% women in orthopedics, and 30% has been determined to be the threshold above which impacts diversity. Increasing diversity in orthopedics improves patient care, decreases healthcare inequities, and makes programs and organizations just better overall. Studies have shown that women are underrepresented in orthopedic awards and less likely to receive a leadership award. Awards are external markers of professional achievement and are important for increasing professional visibility and promotion and career advancement, particularly in academia. There are a number of major orthopedic awards for which a woman has never been selected. And this 0 number pertains, for example, to the American Academy of Orthopedic Surgeons Tipton Leadership Award, the Humanitarian Award, and the American Orthopedic Association Distinguished Contribution to Orthopedics. I think, of course, women should be considered for all orthopedic awards and honors, but there are a number of awards that specifically highlight and recognize achievements of women in orthopedics, and this is important. So the Orthopedic Research Society since 2006 has had a Women's Leadership Forum Award to celebrate accomplishments of women in MSK science and leadership in this field. More recently, the American Orthopedic Foot and Ankle Society has introduced 2 awards just for women, the Career Impact Award for contributions to the field overall, and the Career Development Award for early and mid-career women foot and ankle surgeons. CCOT has sponsors the Marcella Uribe Zamudio Awards. And as mentioned earlier, a number of voice members have been selected for this. And this celebrates a young woman orthopedic surgeon who has published in orthopedics or traumatology. The Indian Orthopedic Association holds a free paper session annually to celebrate diversity, and there's an award in honor of their pioneer, Dr. Mullah Feroz. And just this year, the Ruth Jackson Orthopedic Society has introduced a new award called the She for She Award, recognizing and celebrating a woman who supports and mentors and promotes other women in orthopedic surgery. So in addition to awards, traveling fellowships can be very important for professional advancement, for educational exchange, and for networking. One of the very prestigious international awards, the ABC Traveling Fellowship, which is co-sponsored by the American, British, Canadian, New Zealand, Australian, and South African orthopedic societies, has had only less than 10% of women fellows over the past few decades. Which is considerably lower than the proportions of women in training and in practice, young women in practice. And there are a number of barriers that may keep people from wanting to do a traveling fellowship, and we can talk more about this, and some of them may impact women more than men. So one point is that traveling fellowships may want to consider some adjustments to the time away to make these more appealing. But there are some fellowships that are more specifically for women. The Ruth Jackson Society has the Alexandra Kirkley Academic Traveling Fellowship to support international travel and academic exchange. The Indian Orthopedic Association has many outstanding fellowship opportunities for both men and women, but encourage women participation. And there are many international fellowships, and I think you'll hear more about this in the next 2 talks. In addition to those, research is important, of course, for academic advancement, as well as for improving the field and patient care and patient outcomes. And one of the limiting factors for advancing research is grants and funding. Women should, of course, be considered for all orthopedic grants and opportunities, but there are some opportunities specifically for women. The Orthopedic Research Society has partnered with the Ruth Jackson Society for a Young Female Investigator Grant. And this is open to women from around the world, if you remember. They also support 1 woman each year to attend the Clinician Scholar Career Development Program, which can help propel your career in research. Ruth Jackson has also partnered with Zimmer Biomet for a clinical basic science research grant with preference given to topics in women's MSK health. And there's a comparable resident research grant each year. The Swedish Women in Orthopedic Society has 2 different scholarships, one for 20,000 kronor and one for 10,000, that helps support women in orthopedics to travel to meetings, visit other sites, and to support their research. So in addition to supporting women who are already in orthopedics, there should be attention to increasing women in the field as well. And we know that one of the barriers to this is lack of early exposure. And so some opportunities for women to give them that early exposure are really important. Societies can sponsor scholarships so that young women can attend the annual National Orthopedic Meeting, which is a great opportunity for education and networking. Scholarships for away or visiting rotations, specifically for women or underrepresented students. Selena Poon talked a little bit about this, but there are pathway or pipeline programs to increase exposure to young women. The Perry Initiative has a program for high school women as well as for women in medical school with hands-on opportunities to experience orthopedics. And their data shows that 20% of women who participated in a Perry program have matched to orthopedics compared with 1% of general medical students. They have over 200 women who've matched to orthopedics. Nth Dimensions is an outstanding pathway program for women and underrepresented minority students to give that early exposure to orthopedics. And they also incorporate a strategic mentorship. The South African Female Orthopedic Surgery Society hosted a hands-on early exposure program called So You Want to Be a Surgeon. And the Orthopedic Women's Link and Australian Orthopedic Association hosts an essay contest for young women to help promote gender diversity and increase women in orthopedics. So in summary, women remain underrepresented in orthopedic surgery around the world. Women should certainly be strongly considered for all awards and opportunities, but there are awards, grants, scholarships, and fellowships that are specifically for women, and I would encourage you to take advantage of that. I would also encourage our national societies to increase attention to opportunities to celebrate and highlight the accomplishments of women in orthopedics, as well as to support pipeline or pathway programs so that young women see more about our amazing field. Thank you.
Thank you.